Anemia is a common medical condition characterized by a lack of healthy red blood cells, RBCs, or hemoglobin, a protein in RBCs responsible for carrying oxygen to the body's tissues. When oxygen delivery is insufficient, individuals with anemia may experience fatigue, weakness, and other symptoms that can impact their quality of life. Types of anemia. Anemia is not a singular disease but rather a group of conditions that can be classified into various types based on the underlying cause. The most common types include iron deficiency anemia. This is the most prevalent form of anemia, caused by a deficiency in iron, an essential component of hemoglobin. It often results from inadequate dietary intake, chronic blood loss, example heavy menstrual periods or gastrointestinal bleeding, or malabsorption disorders like celiac disease. Vitamin deficiency anemia, a lack of essential vitamins, particularly vitamin B12 and folate, can impair the production of healthy red blood cells. Pernicious anemia, a type of vitamin B12 deficiency anemia, occurs when the body cannot absorb this vitamin due to a lack of intrinsic factor, a protein needed for its absorption. Aplastic anemia, this rare but serious condition occurs when the bone marrow fails to produce enough blood cells, including red blood cells, white blood cells, and platelets. It may be caused by autoimmune diseases, infections, or exposure to toxins. Hemolytic anemia, this type arises when red blood cells are destroyed faster than they can be produced. It can be inherited, example sickle cell anemia, thalassemia, or acquired through autoimmune diseases, infections, or medications. Anemia of chronic disease, chronic illnesses such as cancer, kidney disease, or inflammatory conditions like rheumatoid arthritis can interfere with red blood cell production or reduce their lifespan. Sickle cell anemia, a genetic condition primarily affecting individuals of African, Mediterranean, or Middle Eastern descent. Sickle cell anemia leads to the production of abnormally shaped red blood cells that can block blood flow and cause severe pain. Symptoms of anemia. The symptoms of anemia vary depending on its severity and underlying cause. Common symptoms include fatigue and weakness, pale or yellowish skin, shortness of breath, dizziness or lightheadedness, chest pain or palpitations, cold hands and feet, headaches. In severe cases, anemia can lead to complications such as heart failure, developmental delays in children, and impaired cognitive function. Causes of anemia. The causes of anemia can be broadly divided into three categories. Blood loss, acute or chronic blood loss due to injuries, surgery, ulcers, menstruation, or gastrointestinal bleeding. Decreased production of red blood cells, conditions that impair bone marrow function, nutrient deficiencies, or chronic diseases. Increased destruction of red blood cells, hemolytic conditions, genetic disorders, or autoimmune diseases. Diagnosis of anemia. Diagnosing anemia typically involves a combination of medical history, physical examination, and laboratory tests, such as complete blood count, CBC. This test measures hemoglobin levels, hematocrit, the proportion of red blood cells in blood, and red blood cell count. Peripheral blood smear, examines the shape and size of red blood cells. Iron studies, include serum iron, ferritin, and total iron binding capacity to evaluate iron levels. Vitamin levels, measures levels of vitamin B12 and folate. Bone marrow biopsy, in cases of aplastic anemia or unexplained anemia, a biopsy may be performed to assess bone marrow function. Treatment of anemia. Treatment for anemia depends on its type and severity. Iron deficiency anemia. Iron supplements. Dietary changes to include iron-rich foods, example red meat, spinach, beans. Treating underlying causes like bleeding. Vitamin deficiency anemia. Vitamin B12 or folate supplements. Intramuscular B12 injections for pernicious anemia. Aplastic anemia. Blood transfusions. Bone marrow transplant. Immunosuppressive therapy. Hemolytic anemia. Treating infections or stopping causative medications. Blood transfusions or steroids in autoimmune cases. Sickle cell anemia. Pain management. Hydroxyurea, a medication that reduces sickling episodes. Blood transfusions or bone marrow transplant in severe cases. Anemia of chronic disease. Treating the underlying condition. Erythropoiesis-stimulating agents for chronic kidney disease. Prevention of anemia. Iron-rich diet, include foods like lean meats, leafy greens, and legumes. Vitamin intake, ensure adequate levels of vitamin B12, folate, and vitamin C for better iron absorption. Routine screening, regular health check UPS, especially for those with chronic diseases or risk factors. Avoidance of toxins, minimize exposure to chemicals that can damage the bone marrow. Conclusion. Anemia is a multifaceted condition that affects millions of people worldwide. While many types are treatable or preventable with dietary and lifestyle changes, others may require more advanced medical interventions. Early detection and management are crucial to prevent complications and improve overall health outcomes. If symptoms of anemia are present, it is essential to seek medical attention for an accurate diagnosis and appropriate treatment plan.